Now, first question with exosomes is always like, okay, well, where should we get them from? Like, what should be the source? And I think that the best source, one of the best sources, is platelets, because platelets are an important cofactor in platelets are an important cofactor in wound healing, and platelets have been shown to be valuable in healing. We do
PRP,
PRF.
No way.
Yes,
this is full circle, Dan.
Come from platelets.
So it releases exosomes.
Calcium triggers the release of the exosome, which contains a growth factor.
Okay.
So there's a company now called Plated, Ryan Pharmaceuticals Plated, and what they do is they stimulate the release of the exosomes from the platelets, and then they package them and put them into a cream.
They just kind of cut out the middleman of all this injury.
Exactly.
Like, hey,
and instead of injury, you go straight to growth.
Yeah.
Which is amazing. You don't need a laser. You don't need a microneedling to trigger the growth factors, to trigger the platelets. You can just put this on your skin, and it's like having a vampire facial every day, 2 times a day. It's amazing.
Oh, okay. So that would be for like skincare.
Yeah, for skincare, but also for improving the quality of your skin and anti-aging. And they did studies that showed that it decreases P16, so it actually stops senescence. Like it down-regulates senescence and actually makes the skin act like it's young again.
I wonder if there's something there, if anybody's doing exosomes for this life extension stuff.
So right now there's this huge push to purify and really qualify what's in them, and a lot of it is nonsense. So I'm actually doing a study with UCLA, Proteomics Core, where we're looking to create a mass spectral fingerprint for exosomes, for quality exosomes, so that people that are selling these products actually send it in and validate that it's actually legitimate exosomes that are in there, because a lot of companies that are there selling these products are just pirates. They're selling nonsense garbage. I personally like platelet-derived exosomes because I know a lot about wound healing.
Sure.
Stem cell-derived exosomes, I'm kind of a little skeptical of.
Gotcha.
Because stem cells play a role in cancer, right? And there's issues that I don't think we fully understand. But platelets, we really understand wound healing.
Yeah.
And I did a whole PhD on PDGF and FGF and VEGF, right? So I know a lot about those growth factors. And I feel like in my practice, that's the thing I'm most comfortable with, is the thing that I have knowledge about.
How much have you changed in your practice since you started?
Oh, a lot. What kind of a question is that?
What percentage?
10,000. And you should be doing 100% change every year. I mean, you should be changing and evolving. Now the techniques have changed, and every time I do a surgery, it's different.
Right.
Every time I operate, it's better. I haven't looked back on a single one of my surgeries and said I'm 100% satisfied. You know what? This patient really needs a lower blepharoplasty too, and we didn't talk to them about that. Or we need to optimize skin. Or you know what? We looked at medical clearance, and I know that we talked about this, but we need to have a good discussion about your factor V Leiden disease.
You're looking at optimizing.
It's looking at
You're always trying to make things better.
I am Sigma 6, baby. I am Sigma 6. I'm not happy until we are 6 degrees apart from everyone else. And I iterate that into the aftercare process too,
Standard deviations is what you're talking about.
Yeah, Sigma 6 means 6 standard deviations from the norm. And that means...
Is that what you consider yourself when you go out to the bars? You're a Sigma 6?